Okay, and we have Deanna here. Hi, Deanna. It's so nice to meet you.
Hi, good to meet you.
Thank you so much for joining us for the CHW Day podcast. We really appreciate it. If you could just state your full name and the current organization that you're working for.
My name is Deanna Perez. I'm currently a community health worker student at Tri-C, but I've been doing clinical hours with the Carmela Rose Health Foundation.
Wonderful. Okay. Well, thank you so much. We just really want to hear more from the CHW's perspective about the impact of the work they're doing, and definitely doing some clinical hours has given you real insight into what that day-to-day work looks like.
Definitely.
So would you like to share us a little bit about what your why is and why you chose this path of work?
Definitely. I left a career as a retail store manager last year, really because of my why. I really wanted a career where I can serve the community and help people and make a difference on individuals' lives, a meaningful difference for positive, just because I feel like that's such a thing that's needed in today's world, that people need assistance with a lot of things. And I just feel like I'm a person that has the capability and the desire to help others get the resources or the connections, whatever they need to thrive and be healthy and well.
How did that career pivot work for you?
Yeah, so I realized one day that I was in the wrong career. I was like, this is not for me. And so I really just started reevaluating like where I wanted to be. I left my position and just kind of took some time to soul search. I did some traveling. I did some just living my life to see like where I really wanted to be. And I landed on community health worker, and I'm super excited about that.
Wow, that's amazing. Like, I love that, that why was probably always in there.
Absolutely, it was.
But you just needed that time and space to really do, like you said, that soul searching to
exactly. And I needed the experience of doing something that was not what I wanted to do to really make me realize like what I did want to do. It's like you have to kind of cross things off and say like, nope, that wasn't for me, before you can find what is your true like passion and desire to do with your life.
Absolutely. Would you like to share a experience that you may have had that may have reinforced the importance of why this work is so necessary?
Absolutely. My family, my dad's side of the family is immigrants from the Dominican Republic. And a few years ago, one of my family members on his side was diagnosed with a brain tumor. But because of low English literacy and just literacy in general, he was not able to navigate the healthcare system on his own. He needed someone to schedule appointments with him, to explain how to take his medications, to explain how to manage his condition. He really had no idea. And even just going to the doctor on his own, he didn't understand. So that really made me realize that so many people need just extra help for whatever reason. They just need someone to help bridge that gap and make that connection for them so that they can understand what they need to do to live a healthy life.
And that's been a really common thread throughout all these interviews, is bridging the gap, filling the gap that exists.
Yeah.
And I think that's such an integral part of what CHWs do.
It is.
Excuse me. So how much longer do you have in your program?
So I have about 3 weeks left of classes as of today. And then I just have I have a few more clinical hours to do, and then I will be able to submit to the Board of Nursing and get my license. So I'm super excited about that.
Well, congratulations. I'm really excited
Thank you.
for you. It's a big journey, especially with that career pivot.
Definitely.
And it's great that you found your place and doing the meaningful work that means so much to you. So I'm looking forward to seeing what you do down the road once you're all finished with school and where you end up.
Thank you. I'm really excited.
Thank you, Deanna, for being here today and sharing your perspective and your experience. We appreciate it so much. Mm-hmm. Have a great rest of your day.
Thank you. You too.
Thank you.